Good afternoon, everyone, and I want to welcome you back today to today's media availability. Minister Haggie will be joining us remotely. And I will now pass it over to Dr. Janice Fitzgerald, who can tell has been taking advantage of some of the services that have been just recently reopened.
Yes, I have. Thank you, Premier. Good afternoon, everyone, and thank you for joining us today. Since the media advisory yesterday, we have no new positive cases in the province, and our total number remains at 261. One person remains in hospital due to the virus, and 256 people have now recovered. In total, we have tested 14,256 people. It has been a little over 2 weeks since the last new confirmed case of COVID-19 in our province, and as things continue to reopen and we resume our new way of life for now, this is exactly the outcome that we were hoping for and aiming for. We are now in a position to move about more freely than we have in months and to participate in activities we enjoy with those we hold dear. So please keep safety in mind while you go out for a meal at your favorite restaurant or do a little shopping or arrange an appointment for some maintenance at your hair salon. And many parks are now open, so please take advantage of our green spaces to enjoy the outdoors. These are all activities we can now avail of safely and with peace of mind thanks to our combined hard work and dedication. Remember, though, that businesses may be doing things a little bit differently to protect their staffs and public, so patience and understandings are a must as we navigate through Alert Level 3. And as we adjust to Alert Level 3 and the return to some of the liberties we have so greatly missed, please continue to maintain a safe distance of at least 2 arms lengths from others while working in public spaces, and wear a non-medical mask when that is not possible. Stay at home if you're feeling unwell and cover your coughs and sneezes. Practice good hand hygiene. By now, we all know the significance of these simple yet critically important prevention measures, and we have done so well so far. And if we continue to do so, and our epidemiological situation stays the same and we see very few cases as we have been doing, then we may be able to move to level 2 by the 3rd week in June. I would like to clarify today the difference between self-isolation requirements for residents returning to our province from traveling and residents who are rotational workers traveling back and forth to the province from another province while on shift rotation. Travelers returning to Newfoundland and Labrador must self-isolate for 14 days upon entering the province. These individuals may go outside only on their own property as long as they are asymptomatic. However, if they develop symptoms of COVID-19, they must remain inside. Rotational workers who travel to and from the province, from another province, who are working away and spending time at home are permitted to go outside. They are allowed to take a walk, go for a drive, go to their cabin or summer homes, provided they are not showing any symptoms of COVID-19, and provided they are not returning from an area where there is an ongoing outbreak of the virus and that they're not coming from an area outside of Canada. Rotational workers are not permitted to enter public spaces such as grocery stores, shopping malls, or banks. They're not allowed to visit family members outside of their household, and they can't allow members of an extended bubble to come into their household. If they live in an apartment building or a condo complex, they are not permitted to go to the common spaces of those buildings. If they are symptomatic, they must remain at home, obviously, and self-isolate, as would anyone who is symptomatic. For more information and guidelines related to travel requirements of businesses and individuals while in Alert Level 3 and the most accurate and up-to-date information regarding COVID-19 in the province, I would encourage you to visit gov.nl.ca/COVID-19 regularly. As we enter what promises to be a beautiful sunny weekend, I encourage each of you to enjoy as much time outdoors as possible with others inside your bubble. But please remember 4 important words: people, space, time, place. The greater number of people you interact with, the greater the risk of spread of COVID-19. For the safety of yourselves and others within your bubble, please keep the number of contacts outside your bubble as small as you can. Physical distancing is imperative to reducing the risk of contracting COVID-19 and spreading it, so please be sure your space can accommodate this important protective measure, so 2 arms lengths between people. And as people spend longer amounts of time together, the risk of infection increases, and spending time together indoors is more risky than spending it outdoors. As summer is right around the corner, we can all look forward to enjoying more time outside. As a recap for those who may have just joined, we have no new cases since yesterday's media advisory, and the total number of cases in the province is 261. As we near the end of our first week of Alert Level 3, I hope the change it brought about has provided you not only a glimpse of more normal times, but a sense of renewed optimism for what we can achieve by working together in partnership with shared value and purpose. We may not have reached the end of this pandemic yet, but we are getting closer every day, and our small steps are making a world of difference. We will get there, and we will do it together. Enjoy your weekend. Have time with those that you love. You've more than earned it. And hold fast. Thanks.
Thank you, Dr. Fitzgerald. Well, we've hit another week, as Dr. Fitzgerald has said, another 2-week streak, I would say, of no new cases in Newfoundland and Labrador. It's a great way to start what looks to be a decent weekend. So you have done a remarkable job on following the guidelines, and once again, you are to be commended for the great work that you're doing in all our communities across our province. I think we can all agree that this pandemic hasn't been easy. It's come with its challenges. It's created a fair amount of hardship within our residents within our province, but we all know that we are in this together, and when we follow the public health guidelines, then we will see success around the corner. Although the virus lives amongst us, you are demolishing the spread, and you have done a remarkable job, as I said. So good on you. Thank you for all your efforts. We are just literally 6 weeks into our plan of NL life with COVID-19, and since March, we've been working extremely hard with industry throughout our province. We've been working with our business community, areas like our tourism industry, our oil and gas industry, and the list could go on and on. We have made every effort to work with them and support them in every way that we can through this pandemic, whether it's providing the guidance documents and reopening of our alert level system throughout the business response team. We've also provided many supports through our partnership with work with our federal government. We speak with them on a regular basis. As of recent times, you know, we've established a $25 million support program to assist the eligible tourism and hospitality-based operators. All of this is complementing the large suite of programs that have been put in place by the federal government. Now, there are many supports that had to be put in place since March, and the response to those programs have been great. Our business response team that we talked quite a bit about has assisted in over 1,300 inquiries, and over 1,200 of them have already been completed. The $25 million program that I just meant to support tourism and hospitality has received over 350 applications this week since it opened on Monday. Now, if you look at the construction industry, there's a lot of attention that's been given to this, and a residential construction rebate program. This includes a 25% rebate on renovation projects, and this is really about residents within our province if you want to do some renovations. That's up to a maximum of $10,000. There's also a $10,000 rebate for new home construction within our province. These rebates that allow homeowners to save money on construction and renovations, but more importantly, will also stimulate the economy and employment for the province's construction industry. Without question, 2020 has been a tough time, given Snowmageddon in a large part of the province and just coming through winter. But given the challenges, some of the numbers that we are seeing today are incredible. We have made a remarkable progress. Since January, as an example for the construction industry, we have tendered and awarded approximately 80 municipal projects valued at some $92 million. So the work of government has been continuing. Now, if you compare that to the same 6-month period in 2019, we tendered just 30 projects last year valued at $24 million. So this year, 80 projects, $92 million. Last year, it was 30 projects at $24 million. So this is a 2.5 times increase in the number of projects and almost 4 times the value. So this is really getting money into our economy and putting our construction industry to work. Now, there's a number of factors that you can contribute that have contributed to the success of getting those tenders out there. It's increased funding and projects through the Investing in Canada Infrastructure Program. This is with our federal colleagues, but also with our province and the municipalities, working closely with consulting and contracting industry to ensure that we have a construction industry that's ready and able to do this work during this COVID-19 period. So it is critical that we continue to support industry as we reopen our province. We have to move forward, but we have to do it when we're ready, and we have to do it when we can do it safely, and we have to do it when the time is right. We've seen what can happen when you reopen or you lift restrictions too fast. Just look in our colleagues in Western Canada, a place like British Columbia, who saw 15 cases this week from one family gathering of just 30 people. Yesterday, Ontario again saw over 200 new cases. Quebec, 144 new cases and 24 deaths. Throughout the country, there are almost 98,000 total cases of COVID-19 across Canada. And right now, of those 98,000, there are still 32,000 that are active. We've seen over 8,000 deaths throughout Canada. So if you look at other countries around the world, like South Korea, their cases spike when restrictions were loosened. If you loosen them too quickly, there's usually an aftermath that happens when this happens. So about 200 cases were linked to nightclubs in that area, and more than 90 infections were traced to church gatherings near Seoul. So you can understand when what I'm saying here is safety and making decisions with a balanced approach is important to us. And these are all things, as we reopen up our economy, that we must consider. Now, from the beginning of this pandemic, we have listened to the Chief Medical Officer of Health and the experts in public health. We've done this to protect citizens from the threat of COVID-19 and to provide guidance for businesses in reopening plans. Decisions must be made, as I said, using a balanced approach. And we've been only at this with our alert system for some 6 weeks. And we do this by using the latest in public health information and based on the evidence and based on the science to allow our economy to reopen safely and without setbacks. We all know the large economic risk if we see another surge in our country and indeed here in Newfoundland and Labrador. We have seen the terrible stories in long-term care homes in BC, in Ontario, and in Quebec, and yes, our neighbors in Nova Scotia. We've been able to protect our most vulnerable and our elderly populations. And in Newfoundland and Labrador now, we're not hearing the language about non-essential travel anymore. People are moving freely around our province with the opening of Alert Level 3. Other provinces like New Brunswick and Quebec still do not have such a freedom of movement they still have regions that are restricted within those provinces. As we look ahead to Alert Level 2, let's continue to move forward with our provincial plan. We know that is working. It only works, as we all know, when we work together as a population. There's lots of opinions that are out there, of course, and we listen to the thoughts and concerns of all Newfoundlanders and Labradorians. But following guidelines, I would remind people, well, that's not a sign of weakness. In fact, it's a sign of wisdom. It's a sign of understanding. So together, we should be wise. We must be wise to protect our families and reopen our economy in a safe manner. Now, speaking of moving forward, this morning we announced another nearly $10 million to create jobs and develop the forestry sectors. Newfoundland and Labrador forestry sector has been an important part of our economy for decades, and it's been a livelihood for many generations. And they have been working, by the way, through this pandemic. And did you know that it's valued at nearly $400 million and nearly 5,000 direct and indirect jobs in Newfoundland and Labrador? So at a time when many of us are facing financial uncertainty due to the challenges of this pandemic has created, we are turning once again to some of the very traditional industries that we would have seen in our province. And those industries, like the forestry industry, are providing new and meaningful economic opportunities. So much of the announcement today will go to support jobs in many rural areas of our province and by investing in things like a silviculture program, our forestry protection program, and forestry product development programs. So it could be anything that would support people on secondary processing, building access roads, planting more trees within our province, or even making sure that we have a pre-commercial thinning program back in place. So the money will be used to support the forestry industry, but again, protect jobs within Newfoundland and Labrador. We'll also be looking at how we use some of the residual forestry biomass program, and this will be used to switch some buildings that we would have in Newfoundland and Labrador, take them off of oil and put them and give them the opportunity to use biomass. We look at buildings as an example in central Newfoundland, like the College of North Atlantic. We see this as a good place to start. So with the challenges that we see in our province, we also know that there are significant opportunities, and these investments that I've just mentioned here can be paired with some of the great innovation that we're seeing within our province and a fresh approach to having a very busy and productive season in the forestry industry. So we all know that this is one industry that has survived many challenging times, and even pre-COVID, the forestry industry has had to deal with a number of challenges, and it's been known for many years for its tenacity and the ability to rise and meet those challenges. So as we continue to protect you during this COVID period, we are constantly looking for ways to support and guide and indeed grow our industries within our province. We know that working with the business community creates jobs for the residents of Newfoundland and Labrador. So if you have any questions about living or working in this new normal, we have a number of resources that are available to you. Just visit that COVID website. It's a great site of information. And as I conclude my remarks today, I want to remind you that today the provincial park day use activity and campgrounds are now permitted. Campers are encouraged to visit our website, nlcamping.ca, to make a campsite reservation. And once again, this is Friday, so over the weekend, you will get your update through a news release that will come out usually around 2 o'clock on Saturday and around 2 again on Sunday. So encourage you to have a happy and a safe weekend, and we'll see you back here at this table on Monday of next week. I will now pass it over to Minister Haggie for his comments today.
Thank you very much, Premier. And like Dr. Fitzgerald, I took benefit of the services, but I don't suspect anyone will notice it compared with others. Again, another great day, 0 cases, testament to the diligence of Newfoundlanders and Labradorians. That's great news. Before I go on to my remarks, I'd just like to thank the Gander Lions for their donation of $10,000 towards PPE. Again, another example of service clubs and service organizations stepping up in times of need. So thank you very much. Over the course of the pandemic, we've heard concerns raised about mental health issues, and in particular around substance use. Newfoundlanders and Labradorians, unfortunately, in some respects, are famous for the quantities of alcohol which they traditionally consume. We lead the country. Over the course of the pandemic, there has been mixed data about alcohol purchase and consumption, but with the suggestion that this has risen. There certainly does not appear to have been any great increase in demand for face-to-face services for alcohol-related issues. But I notice on social media there are things like shop challenges and this kind of thing, which remind me very much of student days rather than more adult behavior. I would caution people about moderation. The problems that you have when you start drinking will be nonetheless when you wake up after you've finished. And I would caution you strongly against excess. There are guidelines on our website for people around alcohol use and moderation. There are sources of help should you feel that your consumption is controlling you rather than the other way around. And they too can be found on our website or through Bridge the Gap or through our warm line and such as those. So I would encourage you to be a little bit careful. And if you need help, seek it. There's no shame in that at all. The other topical subject has been around virtual care, and I just want to make some remarks about context, really. 5 years ago, when I entered this role, it became apparent that we needed to refocus things a little bit in healthcare. And we've chosen and been consistent with an approach on access that's patient-centered, an approach that's based on choice, and recognizing the fact we have some of the best trained family practitioners in the country and the best trained nurse practitioners in the country, as well as other healthcare providers. Our skill set needs to be used to its greatest benefit for the greatest number of people. So over the course of the last 5 years, you will have seen a shift towards primary care teams, which utilize all those skills the best they can be. You will have seen pharmacists prescribing increase, medication reviews. They can now prescribe travel vaccines and preventative inoculation where they couldn't before. You've seen the introduction of midwifery to provide choice with highly skilled practitioners who are skilled in women's health, reproductive health, and childbirth. You have seen us further increase the autonomy of nurse practitioners to allow them to practice to the full limit of their scope of practice. We're in discussions with other healthcare providers, optometrists, psychologists. You've seen barriers to mental health counselling lowered to the point where there are no wait times for counselling in certain areas. And this is part of a consistency. And the announcement that we made yesterday, leading the country in the introduction of accessible, low barrier virtual care by nurse practitioners, is another step in that direction. And it has been very well received by the general public. We, as a province, are open. We are opening more so, I think, than people here would realize. Certainly when compared with other jurisdictions, we are now at a stage where over the next couple of weeks it will become apparent as to how safe it is for us to move around in general. And that's the next step on the road to whatever the new normal might be. So remember, keep your distance, carry on doing the good work that you have in keeping your distance, wear a mask if you can't. And I think Dr. Fitzgerald's 4 words of people, space, time and place should stick in the back of your mind, whatever you do over the next couple of weeks, because we're on track already, perhaps, for level 2 in the 3rd week in June. So with that, Premier, I'll close my remarks and hand the event back to yourself.
Thank you, Minister. And I have to agree. I didn't really notice the haircut like I did to notice the changes for Dr. Fitzgerald. But I appreciate you're just a very competent minister every day of the week anyway, regardless, how we look. So right now, with those comments, I will now turn it over to the media for today's questions.
Thank you, Premier. For the benefit of our speakers, we have 5 reporters registered for today's call. Each reporter will have the opportunity to ask 2 questions and 1 follow-up. We suggest that you not ask or remain questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Please do not press star 1 until your name has been called. Following this, should time permit, there will be an opportunity for single questions. Our first questions today are from Tyler Dunn of POCMC. Please go ahead.
Premier, we've heard a lot of the positives, the funding being poured into certain sectors, flattening the curve, but when are we going to hear a little bit more about the cost of the pandemic on the province and perhaps see a more detailed recovery plan, as mentioned in the letter addressed to yourself from local business leaders?
Yeah, so there's no question there's been cost, and the biggest impact that we would have seen on our budget right now would have been that of a revenue loss. Typically the oil and gas sector, which has been one of a lot of conversations that we would have seen, and regardless, some would argue that not even closely connected to the pandemic. This is another issue that we have to deal with here. So we're currently looking at this from a finance point of view. I think the minister mentioned yesterday about having a budget in place by September of this year. I also mentioned that before I leave my job as Premier here in early August, that I would be in a position that I want to get out, make sure that we have a public statement on an update on the financial situation within our province.
Thank you. And I know this is a federal decision, but as the conversation kind of grows around the Atlantic bubble, what are your thoughts on the border between this province and St. Pierre and Miquelon, who's only had 1 case of COVID-19? Yeah,
and of course, what we've seen right now, I think, is from a ferry point of view, there's been that service has been discontinued now since mid-March. But, it's like on many other areas of the province that we've had a long-lasting relationship with. I had a great discussion this morning with the leaders, along with Dr. Fitzgerald here, along with the leaders in Lab West and some of the adjacent communities in Quebec, the community of Fermat as an example, and the same way in Labrador South as an example, where Blanc-Sablon and Southern Labrador has had a long history of a very friendly relationship in commercial activity and personal services within those areas. So, these are the discussions that we're having right now, and we've been very successful, I must say. There's a lot of cooperation that's occurring amongst those bordering communities, no different than you would see in St. Pierre and Miquelon. So we could see, similar services as the business and family connections continue to evolve as we open up Newfoundland and Labrador.
Thank you. And Dr. Fitzgerald, a little bit more on sports today as well. Teams are wondering if they can't play against other teams, are they able to play against each other in scrimmages, for example? And will competition go ahead in the next alert level?
So the decision not to play games was not my decision. So we gave advice as to how to play safely, and the associations had to take that information and do what they felt was best to keep safety top of mind for their players. And I think, games are games, and the issue is not so much is it your team or another team, it's how you come into contact with people when you're playing those games. So you tend to have more contact, and you may have more opportunity for spread of any kind of respiratory droplets. So that was really more the issue than it being one team more so than another. Certainly as we move forward, we're going to think about how we can do that, how we can establish what we call cohorts of teams to keep things safer. And that is a conversation that's happening not just here, but it's happening at the national level as well. So we will be looking at all of that as we move forward in the coming days, I guess. Yeah.
Thank you.
Our next questions are from Heather Gillis of CBC News. Please go ahead.
Hi there. This is a question for Dr. Fitzgerald or the Premier. Can you clarify what you mean by the third week of June, moving to level 2? Would that be next week, or can you give us some more information about that, please?
My apologies. Yeah, as I was sitting here calculating in my head, I realized third week of June is next week. But what I really meant was the third week of level 3, which would be the week following.
Okay, so just to clarify, that would be the 22nd?
Yeah, the week of the 22nd. Sometime I'm hesitant to give an exact date at that week, but during that week.
I know, Heather. It's a good conversation. We have those all the time. But you know what? I think Dr. Fitzgerald, in all fairness to our Chief Medical Officer here and our team, they have always said, since we announced this alert program just 6 weeks ago, that they were always willing to look at this in not just in 28-day cycles, but they've always made a commitment to the people of the province that if indeed we were in good shape, if the epidemiology within Newfoundland and Labrador was in a positive way, what was happening around our province, all those indicators that we've always mentioned, we've been very consistent with that the timeline between alert levels could change. And this largely depends on the success that we're seeing within our communities within Newfoundland and Labrador. So right now we commend them on the great job that we're doing, and Dr. Fitzgerald and our great team will then make a decision on when we move to alert level 2 when it's appropriate and safe to do so.
So business leaders obviously sent you a letter, and they're asking for an immediate end to the state of medical emergency. I'm just quoting from the letter here. They're asking for a return of the governance of the province to elected officials. Is this something that you're considering now, considering we only have 2 cases? Will you guys end the public state of emergency or the health state of emergency?
Well, first and foremost, governance of the province has never left the elected officials. It's always been there, and that hasn't changed one bit. When we put in place to protect people in Newfoundland and Labrador, we use the science, we use the evidence of our public health officials, and that has been working. And matter of fact, Newfoundland and Labrador has been one of the provinces that many other provinces and many other jurisdictions has been looking to for the success that they've had. So there's 2 different things here. One about the governance, that hasn't changed. Decisions on behalf of Newfoundlanders and Labradorians that we govern, it's always been with our elected officials. And as Premier, that is led by me. Now, from a public health point of view, we have made decisions to protect the health and public safety of Newfoundlanders and Labradorians, taking the advice and the evidence and the science that comes from public health officials. We make decisions sometimes around other areas of government where we reach out and look for support and take advice as well. In this particular case on public health and public safety, we work with our public health officials as we should.
they've also asked for a provincial recovery plan. They say the long-term economic impact could be irreversible if no action is taken. What are your plans for an economic recovery plan?
Well, the alert level system that we've put in place is part of that. We put a $200 million contingency fund in place. There's $74 million of that that's been earmarked to places like the tourism industry and so on. The rebate program is another example. We've been able to make decisions that we would get a rebate on power bills, and the list would go on and on and on. Right now, we work very closely with the federal government to support Newfoundland and Labrador in the oil and gas industry, and I'd encourage all parties and all businesses within Newfoundland and Labrador to get involved in that as well. We do need some support for that industry, and we do need the federal government to step up. When you look at the economy in Newfoundland and Labrador, yes, there's no question we need some support. We needed it before the pandemic, and we must continue to work together with the business community and all Newfoundlanders and Labradorians to work our way through this.
Thank you.
Our next questions are for Peter Jackson of the Telegram. Please go ahead.
Caught off there. With regards to the virtual care business, I know there's a lot of surprise expressed by the NLMA, considering that virtual care has been a consistent theme of the pandemic. I'm wondering, is it possible that the reason this virtual care program or initiative is the first in the country because a national task force last year recommended against it?
No, the reasoning behind virtual care, Peter, is around recommendations from the public. It's recommendations around access. There is science behind it. There is evidence to show that for a significant proportion of consults, virtual care is as effective and probably better received by the participants than face-to-face. Certainly way more convenient. We have instituted a totally integrated system. The documentation and the prescriptions that would be issued are all integrated with our pharmacy network and will be integrated with the provincial electronic health record. So whilst it is episodic care and it is walk-in, and I am no way trying to detract from the value and importance of continuity of care. Facts of the case are physicians have been running walk-in clinics for patients other than their own for a very long time, face-to-face, and now they've been doing it virtually. And this is just another choice, another option, and another route for patients to go should they feel that suits them. It's all about access and it's all about choice.
As a follow to that, why was the NLMA not consulted? Considering that, as I said, virtual care is very much being a part of the collaborative effort between the government and the doctors.
Virtual care was instituted for the NLMA's members at the beginning of the pandemic. We forewent negotiations and simply said, here, fill your boots, pick your platform, and we'll pay for phone or video. So they have their own mechanism. Nurse practitioners or autonomous practitioners, they have the ability to work fully within their scope of practice. I would no more ask the NLMA about a social work consult than a social worker would necessarily do the other. These practitioners are complementary. They work under ideal circumstances as part of teams, and no one group of healthcare providers has a monopoly on providing healthcare to the people of Newfoundland and Labrador. This is a parallel process that is totally integrated in a way that we would love to see some of the other walk-ins integrated, for example.
In terms of integration, the kind of information that these particular walk-in clinics would have electronically wouldn't represent the kind of patient history that a typical doctor's office would have, even if it's shared between different doctors. So isn't that a step backwards in terms of providing consistent patient history-based advice and diagnosis?
It would be if the premise of your question was accurate, Peter, but unfortunately, doctors from different practices do not necessarily have any commonality of record. There are still doctors who are using paper. There are some who have transitioned to siloed versions of the EHR, and there are some who use the regional iteration through Meditech. So that's all fragmented. From this point of view, it's all totally encrypted. It is safe, secure, and it is totally compatible with the electronic health record, both the primary care one that is pushed by TELUS and is part of our provincial primary care initiative, as well as the Meditech, which is the regional health authority version 2. It's also totally integrated from a prescription point of view with paperless prescription direct to the pharmacist of the patient's choice.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. This is for Minister Haggie or Dr. Fitzgerald. NTV spoken with a man who's living in a retirement home, and while they're happy that visitors can now come, they're worried and he's upset that he can't continue his life, that going out and shopping and those independent features he had before are no longer available. Is there any timeline on when this could be happening?
Yeah, so those are discussions that we are having, and you know, we felt we needed to approach this a little slowly and just start with visitation. And certainly we understand the importance of being able to do the things that you're used to doing, and how important that is for your own mental health. So these conversations are ongoing, and we hope to have some more information on that in the upcoming days.
Thank you. And is the province beginning to scale back on testing, noticing that the mobile test site in Corner Brook is now gone?
So I think
Testing is done on the basis of demand. Those sites are currently redundant because the demand is so low. In certain areas, the sites have been kind of mothballed and are ready to be opened again if the need arise. In others, they've been simply dismantled because of the ease of so doing. So we are very much based on Dr. Fitzgerald's recommendations, which are in line with the Public Health Agency of Canada around testing. So we also do some Sentinel surveillance testing, for example. We have begun testing people who attend for aerosol generating procedures at health centres. Now the restrictions on elective work have opened up, and for elective admissions. So that's why the numbers have dropped.
The federal government announced today that they'll be doing temperature checks at airports. Right now, it's just for those entering the country, but it will roll out eventually to be across Canada for travel within the country. What is the province here doing? And we're hearing from some physicians that why isn't this being done at the entrances of hospitals?
So from a federal government's point of view, this is something now that, you know, they have been discussing and they've been considering for, you know, for airports and so on. We're seeing people use, you know, temperature monitoring at a number of different areas right now, and you know, through public health officials, and I think, you know, Minister or Dr. Fitzgerald or Minister Haggie, they could respond to this, you know, why it would not be occurring at hospitals. But, you know, this is one of the measures that you're seeing as people take, you know, temperature checks. I think most of the, you know, the evidence on this has been, you know, it's been a lot of questions, you know, on the usefulness of this particular procedure, but it's been used in a number of different areas, and you know, I think our medical health officials would be able to respond to that if they really would want to.
Yeah, and certainly all patients are being screened for symptoms. There is a screening process in place for everybody who goes into hospital, and that screening process is happening for staff members as well. So it's not like there's nothing there. There is definitely a screening process in place. The evidence on temperature screening is not, I guess it's not unilateral or unanimous, sorry. So there is still some debate as to the effectiveness of using such measures.
Thank you.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hello. I'd like to come back to the letter addressed to you, Premier, from over 50 business leaders. I think it brings up an important question, which is, how does the province actually define a state of emergency? We're in a situation now where we haven't had a new case of COVID-19 since May 7th. We're now allowing things like non-essential travel within the province. How are you defining a state of emergency and the necessity for a state of emergency? And does this mean that we're going to be under a state of emergency until effectively a vaccine is found?
Yeah, so we work with public health officials, and I work with the Department of Health and Community Services. Of course, we have the minister here at the panel, really every day. But I do want to go back to the letter that you just mentioned. So what they're asking in the letter is to end the public health state of emergency, and then that would then essentially make most of the public health decisions that will be made by the politicians. They're also asking for a second thing, which was to not go to level 2, would immediately go to level 1. And so what we've had in place, which is a plan that is really through an alert system that's been only in place for just 6 weeks. And so that would, and as Dr. Fitzgerald has already said, as we move from one level to the other, that is not a predetermined to be 28 days. We can get there, we can get there faster than that if indeed we see the epidemiology in our province that would actually be in a good spot. So it's been 6 weeks. This plan has been in place. We've been at alert level 3 for just 1 week. The plan is working. I mean, I guess you could argue the merits of where we are and how effective the state of emergency has been. But what I do know is literally about 2 months ago, we were really having difficulty even getting essential trucking industry having a place where they could actually rest and provide washroom facilities, even get a meal. So we've come a long ways, and we should not forget where we've come from in just a couple months. This is where we were a couple months ago. This is where we are today. We are here today because we have successfully worked our way through this program, through this alert system, because we have the support of Newfoundlanders and Labradorians, which includes the many businesses that have been very successful and working with the province throughout this pandemic. So the letter was addressed to me. It came into me. It was labeled personal and confidential. That's how it got to me. I got this earlier this week, and it was a personal confidential letter that came in addressing those two concerns. And if Mr. Haggie would like to speak to the state of emergency that has been really been signed every 2 weeks since it was put in place late March, I'm sure he can add some comments to that.
Yeah, yes, thank you, Premier. I think a little bit of flavour or context would be useful. The only way that we can ensure public health in a time like this is by the use of special measures orders. You've seen how effective they have been in terms of locking down, for want of a better word, the province. And as we said, it would be far harder to undo that than it would be to institute them. The only way we have of doing that in a controlled way and avoiding some of the pitfalls that you've seen even in provinces which do have those controls is to have an overarching state of public health emergency. Because without that, there are no such things as special measures orders. There is no such thing as the ability to control or require people entering the province to do anything at all. It is literally business as in February. And I think even at this stage, and particularly in relation to inter-provincial travel, that would expose this province to what I have been informed could potentially be an unacceptable level of risk. So it stays for the moment until Dr. Fitzgerald and the epidemiologists provide me with advice to the contrary.
Yeah, so Patrick, it really draws some attention of where we are compared to other provinces. And I know as we sit here today, of the 10 provinces and 3 territories, 5 provinces currently right now, if you go into another province, there's a 14-day isolation plan in place. So if you go into any of the other 4 provinces, including Newfoundland and Labrador, you must self-isolate for 14 days. And in all 3 territories, if you go into a territory, you must self-isolate for 14 days. So this is not just in Newfoundland and Labrador. We still have 5 provinces and 3 territories that have isolation plans in place.
Just to follow up on that, another thing that this letter talks about is they basically made the point that the focus of the province is almost unilaterally on health, and that we've almost got our blinders on regarding the economy, and that in that way it seems like we're focused on having effectively no cases as our target, and not on these prolonged economic impacts, which have their own health and financial impacts. What do you make of that? How do you respond to that criticism that we're so focused on health and not enough on the economy and the impacts that has on the lives of people in this province?
I understand that. I mean, I spent, nearly 3 decades in business as well, so I understand where why that comment would be made. But I also know that what's important for the general population, the over, 500,000 Newfoundlanders and Labradorians, we had to find a balance. We know that from a business point of view, and this letter has about 50 business owners within Newfoundland and Labrador. There are thousands of business owners, and I know they speak. And I've talked to many of those people, through this pandemic many times. So these are not strangers to me. We've taken advice, and as we would with our public health officials as well as we move through this. But I think this is a very different time, and we must realize that if we're safely to reopen our businesses, these customers that we're talking about, the everyday Newfoundlander and Labradorian, the over 500,000 people that live and enjoy our province, they must safely be able to be the customers of some of those businesses that we're talking about here today. So it's a balanced approach, and we can't ignore the fact that what a surge would have, or having to deal with and close up the businesses again within our province, and therefore put pressure on our healthcare system again. So it's one of balance, trying to prevent a resurgence of this virus within our community, keeping our businesses safely open. So this is why the plan that we put in place is working, and it's been working because we've got a level of cooperation with all Newfoundlanders and Labradorians, including many of our business owners that we see within our province. So it's a balanced approach. We have not given up on the economy. A matter of fact, our mining industry, our forestry industry, our fishing industry, even our oil and gas industry, with all the pressure that it's had, has been working through this pandemic. Our grocery stores, our pharmacies, our healthcare system has been working, and so there's been quite a bit of activity within our province. Yes, we still have challenges. There's still a few businesses that would need to be open, but the major changes that we're seeing in the economy are people, I would say, would be hard-pressed to find a service that they can't get in Newfoundland and Labrador now in some fashion. And as we move into Alert Level 2, you'll even see more opened up. So it's not about picking one or the other. It's about making sure we do all of it safely.
Okay, and another follow-up on this, and it's been all my questions on it today, I think.
It's good.
When we say working, is the goal, is the target for the province right now, in the absence of a more of a formal economic relaunching plan? Sorry, I'm Gallicizing again. Is the target 0 cases? Is that our goal in the absence of an economic relaunch sort of plan? Sorry.
No, and not at all. Just by the name of the plan at all is life with COVID in Newfoundland and Labrador. So NL, live with COVID-19. So that plan itself, by its very name, demonstrates the fact that this virus will be around Newfoundland and Labrador for quite some time. There's 32,000 active cases in the country today. So as Canadians move around, and as we expose ourselves to introducing positive cases of COVID within our province, we are aware of that. But we must keep in mind we must have the healthcare system that can respond if we get another surge. We must have appropriate amounts of PPE within Newfoundland and Labrador if we had to deal with another surge. The impact on the economy, if we had to shut this place down again, would be tremendous. And the cost of even opening it up again will be even greater the next time around. So, we want to do this. It requires patience. It requires a plan. That plan was put in place the end of April of this year. And we will always continue to work with the business community. But we must remember that we have over 5,000 Newfoundlanders and Labradorians. Expect us to keep them safe as well.
Thank you.
Thank you very much. The time for questions has ended. Please join us on Monday, June 15th at 2 p.m., 1:30 in Moncton, Labrador. Have a great